Good evening. Good evening, everyone. Welcome to tonight's episode of the X Mary and Pat Show. Let's get situated here, make sure we're on the right foot. All righty. So good to have everyone on who's on Zoom as well as on Facebook. My name is Thomas Robertson, but everyone, by now you should know that everyone calls me Duke. I am the Technology and Matrix Director for Oak Hill Regional Community Development Corporation, which is the parent corporation of Healthy Kids Mississippi. We recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. In addition to the Zoomcast, we are restreaming this evening's webinar on our Oak Hill Regional CDC and Healthy Kids Mississippi Facebook pages. So please feel free to share in the like on your social media, post comments or any questions that you may have. We make sure that we try to get to those questions. If not, we will follow up with you with the answers to those questions. Tonight, Ms. Mary Fenner, Ms. Pat Bogle have a ton of questions, so I'm not going to hold. I do want to inform you about a couple of announcements. Our next Mary and Pat webinar will be on its regular scheduled time, which is the last Monday of the month. This month, we didn't do it on the last month because it was Halloween, so we moved it up a week. But for November, it'll be November 28th at 6 p.m. Also, we want you guys to be aware of our third Wednesday Parent Resource Chat, which is the third Wednesday of every month. We will give the date for that and the topic at the end of this webinar so you guys can put it in this calendar. So without prolonging the time, I'm going to turn it over to the stars of the show, Ms. Mary Fenner and Ms. Pat Bogle. Ladies, you may take it away.
Good evening, good evening. We are honored to be here with you on today. And this is Pat Bogle. And of course, we are ready for your questions.
Good evening, everyone. I'm Mary Fenner, and we are ready.
Okay. And we want to thank all of our guests for joining us on this evening. We also have Ms. May Stigler, one of our applications administrators, on standby to join us. We also, I see we have Ms. Doretha Knox, another applications administrator. Okay, but our first question, my kids don't have Medicaid or CHIP or any kind of health insurance. They really don't get sick. So I didn't think they needed insurance. Why do we need to sign them up for Medicaid? Okay, and the answer to that question would be everyone needs health insurance, some kind of health insurance. Children need annual checkups. They have screenings like vision, dental, and various physicals. Regular checkups help to ensure that they are healthy and don't have any some kind of hidden illness or disease. So many viruses and diseases are on the rise now. Recently with the respiratory disease, RSV, I'm sure you all have probably heard of it. And this is affecting babies and children and putting so many in the hospitals and it's rapidly spreading. You may not see an illness in your children, but it doesn't mean one isn't there or won't come up. Medicaid and CHIP offers free health insurance for children ages 0 to 19 if you qualify. And we just encourage you to please apply ASAP for your children.
Okay, the next question we have is, what if I just started a new job and haven't had a chance to receive any paycheck stubs? But I have my letter from my employer, and the letter verifies my hourly salary and also the number of hours I work per week. Can I use this to verify my income to apply for Medicaid for my 2 children? And the answer is yes. This should be sufficient as verification of income, as long as the letter is signed by your employer and have the date that you started your employment on it and is current.
Okay. And we have another question. I applied for Medicaid CHIP for my son a couple of months ago and was denied because my income was over the income limit. Can I reapply now since my hours have been decreased and I receive much less than I was making then? And the answer is yes, you can reapply. And if you're denied again, you may want to apply for affordable health care insurance through ACA, and that will be considered as a life change because you've been denied Medicaid or CHIP. So you would qualify for a special enrollment. So you definitely want to go ahead and reapply for that Medicaid.
Okay, our next question is, I saw flyers and a sign would get covered Mississippi at my child's local Head Start Center. Who do I contact about applying for Medicaid or CHIP for my daughter? You can apply with any of the sisters at the Head Start Centers. If you are at a Head Start that doesn't have any sisters, then you can call our office at 662-298-3584. And that's Oak Hill Regional Community Development Corporation. And the number again is 662-298-3584. And you can ask for one of the sisters. We can complete the application for you over the phone, or we can meet you at the library or one of the restaurants. And we submit it for you to the Medicaid office.
Okay. Let me see. We have another question. What do I need to do if a doctor or provider does not accept my Medicaid coverage? Well, you will need to contact Medicaid to assist with locating a provider that does accept your Medicaid. And of course, it is also possible that you can switch to a different Medicaid coverage that this doctor or provider will accept or does accept. Of course, there's Molina, United Healthcare. And so I know those are 2 that are offered through Medicaid. So if you're on Molina and they don't accept Molina, if you really want to go to that provider, you may need to contact Medicaid to see about switching to United Healthcare.
Okay, our next question is, my daughter turned 19 a few weeks ago and her Medicaid was closed. A week or 2 later, I received a letter from Medicaid that states she has been approved for COVID Medicaid. It is our understanding that COVID Medicaid is Medicaid that's given to people who, because of the public health emergency. So even though it may say COVID Medicaid, it should cover everything that you need when you go to the doctor. If you go to the doctor and the doctor said, well, we're not taking this, then you can contact your Medicaid office. Contact the Medicaid office and ask them, maybe you can go to a different provider that will take it. but they should take it because you have it because of the public health emergency.
Yes. Okay. And Sister Stigler, do you have any thing you would like to share on that?
Anytime you're having a problem with a doctor or provider that do not accept your insurance card that you have through Medicaid, you can always switch once a year to a different insurance company through the Medicaid office. But you will need to make sure that your doctor accept Medicaid. Some providers do not accept Medicaid, no matter if you have United or Millennium. So you want to make sure that they will accept it. If not, then you have to go to another provider for the care that you need.
Okay. Thank you. And one of the questions we've been asked also is, what is a public health emergency? And of course, that the public health emergency that was brought about right after the pandemic of the COVID pandemic, and of course, the Department of Health and Human Services (HHS) they did not want any children or families on Medicaid to go without health insurance, so they came up with the public health emergency. Now, it was supposed to have ended earlier. Was it earlier this summer? But it was extended for 3 months. And then it was supposed to end in October. And then in October, they extended it to the first of the year. So right now, we are waiting to hear if it's going to be extended again. But that is what the public health emergency is all about.
And they have to notify Medicaid. I think is it 60 days prior to when the public health emergency is going to close. So we know for sure 60 days from now, up to 60 days is on.
Okay.
Yeah, so. Okay, I had pregnancy Medicaid to cover prenatal health coverage during my pregnancy, and 2 months after the birth of my child, I thought it was closed because my child was born 3 months ago. I went to the doctor and found out I still have pregnancy Medicaid coverage. How long would I be able to receive Medicaid? Well, the way it stands right now, Medicaid is not closing any cases.
Mm-hmm.
So if you currently have Medicaid and you have pregnancy Medicaid, more than likely you still have it. But to make sure, to verify, and if you're not sure, call your Medicaid office and talk to your worker and ask your worker about it. But right now, because of the public health emergency, they are not closing any cases at all.
That is definitely great to know. Okay, at this time, we're going to take a commercial break, and we will be right back with more Ask Mary and Pat. Okay, thank you, Duke. And I see that there is a question in the chat from Miss Brenda Wilson. And her question is, where are we with the public health emergency? And of course, we just discussed that. Of course, again, Sister Fenner, you mentioned that right now it's up until the first of the year, but they will let us know at least 60 days in advance of whether or not, it will be extended. So that answers your question. Okay. I have a question here. My husband and I have been in the United States for 8 years. We have 2 children who were born in the United States. Can we apply for Medicaid for them since I am employed? Okay, the answer to that question is yes, you can apply for them. They are U.S. citizens since they were born in the United States, and but you will have to meet requirements as far as qualifying income, and you have to submit any documents that Medicaid requests, especially dates of birth, and they will be asking for the children's social security numbers since they are U.S. citizens, and you have to submit your address as well. And Sister Fenner, do you have any more to add to that one?
No, that's exactly it. That you have to meet the requirements. What are the requirements? Income level, your household size. All that bears on whether your children qualify for Medicaid or not. But you do have to, if you're applying, you do have to submit their social security numbers, but you do not necessarily have to submit yours if you're not put in the application. If you're not applying, Medicaid does not need your social security number. They only need the social security numbers of the applicants.
Okay. And of course, well, if there's one, they may not, depending on income, the parents may not qualify, even if they are documented, they may not qualify because of their income. Their income may go over the limit.
Right.
Okay.
Okay.
And again, we have a guest with us, Sister May Stigler. Do you have anything to add to that?
I think y'all covered everything that I know on that.
Okay. We appreciate you so much.
And we have Miss Knox on.
Yes.
Do you have anything to say about that question, Miss Knox?
No, only because they are not United States citizens, only and they are applying for the children. Only a portion of their income will be used in the application to determine eligibility, but they must submit all their income.
Mm-hmm. Okay. Thank you.
Okay, our next question is, I have pregnancy Medicaid and have the worst toothache. Can I use my Medicaid and go to the dentist? Unfortunately, pregnancy Medicaid does not cover dental or vision. It only covers pregnancy-related services. Even though it may seem when you get pregnant, you always get a toothache.
Always get a toothache.
You always start having problems with your teeth. That's because your calcium level is dropping because of the baby. But Medicaid still will not cover it.
We really hate that because as being former Medicaid specialist with the Division of Medicaid, we ran across that a lot. We had a lot of our clients calling in and coming in and, and stating that they had such a bad toothache and they really needed to see a dentist, but Medicaid won't cover it. And actually, I don't think that the doctor, and quote me if I'm wrong, I don't think the doctor will do very much as far as the toothache while you're pregnant anyway.
They will pull it if you're pregnant. They will pull it if you want it. Yeah, they will do that if it's causing you that much problem.
They will go ahead and pull it.
Mm-hmm.
Okay, that's good because most of the time, they want to, they don't want to give you much. They tell you to take Tylenol or what have you because of the pregnancy. But it's good to know that they will go ahead and pull it. But no, Medicaid won't cover it though.
No, they will not. Okay, our next question. Oh, it's Pat. Do you have a question?
Okay, well, you can go ahead.
Okay.
Well, I can take this one.
Go ahead.
I'm sorry. I can
That's
take
all right.
it. Okay. If I move and put in a forwarding request with the post office, do I still need to contact the Medicaid office to give them my correct address? And the answer to that is definitely yes. Okay, because the post office is not going to, well, Medicaid won't accept a forwarding address. You will have to contact the Medicaid office, because if you don't, they're going to continue to send that correspondence to the address they have on file. So make sure that you contact the Medicaid office and give them your updated address. So Ms. May Stigler, you have anything further on that?
You always want to contact the Medicaid office anytime you move and let them know that you moved and your new address and your new phone number. You want to always, we can't stress that enough, that you need to contact the Medicaid office and make sure they have your current address and current phone number at all times.
Yes, and right now, with us not knowing what's going to happen with the public health emergency, that may end, as we stated, in just a few months. It may not, and then it just may. And so if you're on the public health emergency Medicaid now, when they contact you, they're going to give you, I believe, about 60 days to make preparations to get some other form of health insurance. But they will be sending letters out to the consumers or to the clients. So definitely make sure you get your addresses corrected, your correct addresses. If you have moved, get that into the Medicaid office as soon as possible.
Okay. We have a question in the chat that it came from Facebook. And the question is, if I am out of town and my child is on Mississippi Medicaid and gets sick, will Mississippi Medicaid pay an out-of-town doctor? I believe that Medicaid will pay for emergency services. If you out of town and you have to go to the emergency room, and if it's that case,
Right.
then it should be covered. As long as it's an emergency.
Yes.
Also, Sister Fenner, I'm just going to add this. This is May Stigler. Anytime you out of town and have an emergency, Medicaid will cover that, because Medicaid do pay out-of-state claims.
Mm-hmm. Okay. We pray that this doesn't happen, but sometimes it does. Okay.
Okay. I know a lot of people have questions about what are the income limits for Medicaid.
Mm-hmm.
And in order to find out the income limits, you need to go to www.medicaid.ms.gov. And you can check, there's a list on that website to let you know what the income limits are. If you applied and you feel like your child was denied, or you were denied, and they told you it was because of the income limit, you were over the income limit, you can always go in there and check and see what the income limits are for Medicaid. Now, if your income changes and then you can reapply. If you've been denied, you can reapply for Medicaid.
Okay. All right. And again, as I mentioned earlier about the public health emergency ending, we are prepared and ready. The open enrollment starts November the 1st of 2022. So we're also navigators, and of course, Oak Hill Regional Community Development's Get Covered Mississippi. We are here to assist you with affordable health care insurance through the ACA. So do not panic because your Medicaid gets, terminated after the public health emergency, because our navigators are here and we're ready to assist you to get you enrolled in affordable health care insurance.
And that was one of our questions. Someone said that they were 19 and they
Right.
would no longer be eligible for Medicaid after the public health emergency ends. And what were their options? And that's exactly it. We have the Affordable Care Act that they can apply for. They may be eligible for that, or we can also refer you to the federally qualified health centers where
Right,
you can pay at a reduced fee.
right. Okay. Well, Duke is going to come back with another commercial, and we have, I think, another question in the chat, and so we'll take that as soon as we come back.
CHIP has established itself as a critical piece of the federal state response to children's health care needs. CHIP, signed into law on August 5, 1997 by former President Bill Clinton, was created to build on the success of Medicaid by giving states the opportunity to receive enhanced federal matching funds to expand affordable health coverage to children and families that earn too much to qualify for Medicaid but too little to afford private health insurance. Over the past 25 years, CHIP and Medicaid have sharply reduced the rate of uninsured children in the U.S. Together, they have successfully kept children connected to health coverage and played an important role during recent economic downturns and public health emergencies in the state of Mississippi. The Children's Health Insurance Program provides insurance coverage for uninsured children up to age 19 whose family's income does not exceed 209% of federal poverty level. Families may earn up to 209% of the federal poverty level and be eligible for CHIP. A child must be determined ineligible for Medicaid before eligibility for CHIP can be considered. Children with current health insurance coverage at the time of application are not eligible for CHIP. Our organization, Oak Hill Regional Community Development Corporation, is focused on raising public awareness about health coverage options for children and their parents through our Healthy Kids Mississippi initiative. To learn more about our organization, visit us on our website, healthykidsms.org. Give us a call at 662-298-3584 or text us at 662-689-9712. We are always ready to assist.
Wow. We couldn't have said it any better.
Right. That was a really nice commercial.
Yes, yes. Okay. I thought we had another question in the chat, but we do have other questions. Let me see. TANF has a limit of how long you can. Did we go over that one? TANF has a limit of how long you can receive benefits. Does Medicaid have a limit of how long you can receive benefits? Okay. That answer is no, there is not a limit, but everything is based on eligibility, age, income, and household. Now, normally you would have to renew your Medicaid or your CHIP once a year. But with the public health emergency, some offices are rolling over your Medicaid. But again, that's the only thing now. There's a renewal process, and if you receive your letter and you don't respond within that time limit, now your Medicaid may end, and then you would have to go back and reapply. But other than that, no limit. Ms. Stigler, you have anything on that, or Ms. Knox? I think they're on me. Okay.
No, I think you covered it. As long as you are eligible due to your income and household size, you can stay long as long as you're eligible. You can stay. There's no time limit.
Thank you.
Household size and age.
Yes. Thank you.
I agree.
Okay. And we do want to thank our we call them our backups. And we appreciate them. Ms. May Stigler, again, she's an sister and a navigator with Healthy Kids Mississippi and Get Covered Mississippi, as well as Mrs. Doretha Knox. And we appreciate them so much. I mean, when we come together, I mean, we make it happen.
Yes, we do. Okay, there's another question. My sister lives in Illinois and get Medicaid. I have applied for Medicaid here in Mississippi, but was denied. Okay, your denial could be a number of reasons, but one of the main reasons is that Medicaid was not expanded here in Mississippi. Illinois' Medicaid was expanded to cover more people, where Mississippi it wasn't. The age group between 19 to 64 years old has Medicaid does not cover them. Now, unless they have children in the household that's under the age of 18. Other than that, there's no category, no type of Medicaid benefits for them, but they can always apply for the Affordable Care Act.
Okay. Okay, now see that there is another question. Do you have to go to certain doctors? Okay, well, you can actually go to any doctors who accept Medicaid, and we discussed that earlier. If you go to a particular doctor, and for instance, if your primary healthcare physician refers you to a specialist, now I'm sure they will find out in advance whether or not they accept Medicaid. You know, sometimes they may not want to accept what Medicaid pays, you know, how much they pay, but you can go to that doctor, or you can get your primary healthcare physician to check on another specialist to see, and then sometimes there may be one that won't accept it, but you can go to any doctor that accepts Medicaid or CHIP. Okay.
Okay. There's another question. Okay, what gets your Medicaid denied or canceled? And a couple of reasons are with not responding to letters requesting more information. That's so important. Not submitting the requested information on time, because they give you so many days to submit it.
Right.
And mail sent back undeliverable. If they do not have a current address on you and the mail goes back to the Medicaid office as undeliverable, your Medicaid will be canceled. So those are, you must keep up with your mail. You must open up all mail from the Medicaid office. You may not want to, but you really need to in order to stay informed about your Medicaid case.
Yes.
So you won't have a gap in your children's cases or your cases if you're on Medicaid.
Right. Right. Yes, I was recently contacted by a young lady that stated that she said, I got my letter, but I don't even know where it is. And so she actually, I think how she found out that the Medicaid was, that her case was closed was she took her child to the doctor and they told her, I'm sorry, you no longer have Medicaid. And for a moment there, I believe she was shocked, and didn't realize that it was closed, but it was probably because she did not open that mail.
Right.
And then if you open it, you got to read it.
Because I'm sure they're giving you some type of information or requesting information from you.
Right.
So it's important that you open up that mail and read it and respond to it.
Yes.
That mail. And if you haven't heard from Medicaid in a while, it might be call them and talk to your caseworker and just ask them, I just need to know what's going on, if my case is all right, or get a relationship with your caseworker so they'll know you. And sometimes they will call you if they don't have a backlog, and if they're able, they can call you and let you know some things too. But make sure you keep in contact with them. Let them know that you're interested in keeping your child's Medicaid or your Medicaid. So sometimes it may get hard to get in touch with them, but keep trying.
Right.
Mm-hmm.
That's definitely true. Okay. Ms. Stigler, Ms. Knox, you have anything to add to that?
I don't have anything.
And if for some reason your Medicaid case get closed and you need some help doing the application, you can always call our office. That number is 662-298-3584. We're waiting to hear from you.
Right.
Yes, we are.
Yes. Yes, indeed. Now we hope that you are writing that number down and put it somewhere close. Okay. Let's see, what else do we have? Do we have another question? Okay. If you moved to Mississippi and was on Medicaid in that state, does your Medicaid move with you? No, it doesn't. You have to cancel your Medicaid from that state and make sure, for instance, if you're moving from Atlanta, Georgia to Mississippi, you have to apply for Mississippi Medicaid. And in the process of applying, you let that worker know that you have Medicaid from another state, but you may want to go ahead and contact them yourself and tell them you need to get it closed so you can apply for Mississippi Medicaid, because you cannot have both. You definitely, you don't want to get in trouble for that. So no, it does not move with you.
That's true. If you move, you must, and it's important that you do it right away. If you know you're going to be here permanently in Mississippi, then you need to contact the state that you moved from and let them know that you have moved. And sometimes a letter is required showing that you have closed that case. So ask them to send you something in the mail letting you know that the case has been closed, just in case the worker asks for proof that the case has been closed. And you do have to put in an application with Mississippi Medicaid.
Yes, because you can definitely make a call, and the case still hasn't been closed, so it's best to follow up on that. Again, you definitely don't want to have two different types of coverage and get in trouble.
Right.
Okay. Trying to see if there was another question in the chat. It's not. Do any of our panelists have any questions? Okay, so we're going to take another commercial break and we will be right back. Okay, in the meantime, don't forget our number to contact us if you need assistance with applying for Medicaid at 662-298-3584.
There are Mississippians applying for health insurance that may not qualify for a program. However, we all know it is important for families to have health insurance. This is why Healthy Kids Mississippi has been working with our state's federally qualified community health centers, or FQCHC, to help our fellow citizens find a medical home. Our organization is focused on raising public awareness about health coverage options for children and their parents through the Medicaid and Children's Health Insurance Program, or CHIP, in the state of Mississippi. Our process is simple. Our organization's assisters seek out Mississippians. Once our assisters gather the necessary information from the consumer, they apply for insurance programs on behalf of them when consent is given. When the application process is complete, the applicant will find out by mail if their application has been approved. We want to help as many families in Mississippi as we can. To learn more about our organization, please visit us on our website, healthykidsms.org, or give us a call at 662-298-3584. We welcome you.
Okay. Duke, do we have any questions from Facebook?
I know November the 1st is our open enrollment. You had mentioned it earlier about the Affordable Care Act. Open enrollment starts November the 1st. And Duke, are we having a marathon?
Yes, we will have a telethon.
Telethon?
Next November 1st, we will have it. I'll give more information about that once the ladies have answered all the questions. That's what I'm doing behind the scenes, trying to gather information now.
Okay.
We want to thank Duke, our engineer. He does such a wonderful job. And our commercials, they're very informative, and gosh, we just love them. But anyway, we thank you, each of you that have asked questions, and Duke will let us know again our next Ask Mary and Pat.
And Ms. Stigler and Ms. Knox, do you have anything else to add?
This is May Stigler. Again, I would just like to say, we here at Oak Hill Regional Community Development Corporation, we're here to help. That phone number again is 662-298-3584. Thank you.
I don't have anything, Ms. Fenner.
Okay.
And you may see us out in the community. We are, we do outreach in our various areas, and we have some flyers. We actually have new flyers ready to distribute. And of course, if you see us, feel free to come up and talk with us. We can provide any information. You may have any questions when we're out and about. I don't have anything coming up this month. Sister Fenner, do you have anything coming up this month? The month is almost ended.
Oh, yes, I have breast cancer walk.
Okay.
It's this Saturday. It starts at 9 o'clock. You can come and register. Registration is free, so everything is free, and it's in honor of my daughter-in-law. She's been through it, and she has a walk every year, annual walk, to honor those who's gone through, those who are still struggling, and those who have lost ones that have lost the fight. So if anyone's not doing anything, you can come out and walk with us. It's at Como Park in Como, Mississippi. There's no address for the park, but you can ask anybody where the park is. It's only one park in Como. So just come out and walk with us. Or even if you can't walk, just fellowship with us, because we will be sitting around. There will be different tables. We're going to have probably the Affordable Care Act table, also a Healthy Kids Mississippi table, and an All of Us table. So you can come out and we'll be there.
And if you have any event that you would like us to come out to, we are available. Well, we'll check our books, and if we're available, we'll come. You may have a Fall Fest coming up, or a health fair, or any kind of public event. We would be glad to come out and present information. And again, we'll answer any questions you may have there as well. All right, Duke, we don't see any more questions.
All right, let me check one more time on social media. All right, I think you guys have answered all those questions. Once again, great job as always, ladies. You guys certainly get the information out to everyone, and it is just good information for anyone to have, not only for the people in Mississippi, but also the people that are across the country, because Medicaid is all across the country, as well as the Affordable Care Act. But we do want to make you aware that open enrollment for the ACA starts November 1st. And here at Oak Hill Regional CDC, we will be doing a telethon for the whole day. We will have different times where our site locations will show up and talk about what's going on in their community. We will start promptly at 8 a.m. and go until probably 8 o'clock that night, if I'm not mistaken. But we're still working out the logistics for that. That'll be November 1st at 8 a.m., the ACA Telethon. Also, events that we're having. We have our third Wednesday Parent Resource Chat. That is every third Wednesday in the month. Next month, we'll be focused on library resources. So if you would like to tune in, please inbox us or call the office at 662-298-3584 or text us at 662-689-9712, and we will gladly send you the link for that. The next Ask Mary and Pat show will be back to its scheduled time for November 28th, the last Monday in the month. Now, I don't believe I missed any of our events. I think I think that's all of it, Ms. Spinner, Ms. Boga.
Yes.
Yes.
All righty. If no one else has anything else, you may learn more about us at oakhillregionalcdc.com and www.healthykidsms.org. Or you can also visit our ACA site, getcoveredms.org. You can, once again, you can contact our office, 662-298-3584, and text us at 662-689-9712. We want to make sure that you have those numbers. We're going to repeat again, 662-298-3584, and text 662-689-9712. I hope you have written that number down by now, because we've said it over 100 times, but just in case you missed it, 662-298-3584 and text 662-689-9712. We acknowledge our board chair, Jennifer Garrett, our executive director, Dr. Michael O. Minor, and our project director, Mrs. Lottie Minor. This has been a production of Oak Hill Regional Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the state of Mississippi. Thanks for tuning in, you guys, and I hope to see you guys next month, November 28th at 6 p.m. You all have a great rest of your night.